Medical Education 2, the Foundation Program. The Foundation Program is a 2-year training program which forms the bridge between university-level study and medical school and specialist or general practice training. It consists of a series of placements, each lasting for 4 months, which allow the junior doctor known as a trainee to sample different specialties. For example, pediatrics, a year training FY1 correspond to pre-registration house officer PRHO, post and a year to training FG2 to senior house officer SHO. Post, each training has an educational supervisor who ensures that more senior doctors deliver training in different ways, including clinical and educational supervision. To progress, trainees have to demonstrate a range of clinical competencies which are assessed through observation in their workplace. P. People in medical education. Tutor, an academic, or in some case, a postgraduate student who leads tutorial. Demonstrator, in anatomy teaching, someone who demonstrates how to dissect. Demonstrators are often postgraduate students paying their way through medical school. Lecturers, senior lecturer, an academic with teaching and research responsibilities who contributes to the teaching of a particular discipline. Professor, a senior academic with teaching and research responsibilities for a particular discipline, usually a leading figure in their discipline. College tutor, a consultant responsible for delivering a college training program. A clinical trainer, a consultant assigned to a trainee who provides training during periods of direct clinical care. Education supervisor, a consultant who supervises a training period of training. C, medical qualifications, BMCLSC or BMEDSCE, Bachelor of Medical Science, a degree often taken after 3 years of medical studies by students who may wish to follow a career in medical research. MBCH, BMBBS, B or BMBCH or BMBS, Bachelor of Medicine, Bachelor of Surgery. Bachelor degrees are undergraduate degrees. This is the first degree for UK doctors. MD or DM, Doctor of Medicine, DRCOG, Diploma of the Royal College of Obstetrics and Gynecology, MRCP, Member of the Royal College of Physicians or Member of the Royal College of Surgeons. Doctors become members by successfully completing the assessment produce procedures in their college. PRCS, PRCS ED, PRCS Glass, PRCS E. Fellow of the Royal College of Surgeons of England. Our colors are indicated by the letters which follow, for example, Edinburgh, Glasgow, or Ireland. How doctors become a fellow depends of their college. For the FRCS, further examination must be passed for our college. It is by nomination or work assignment. Complete the phrases with varies from the box. Two phrases can be complete in two different ways. Look at A and B opposite to help you. Assess, deliver, demonstrate, provide, supervise, take. Demonstrate a competence or how to do something. Supervise a training by ensuring she successfully completes her training. Deliver a course or a training program as a teacher. Take a course or a training program as a student. Assess progress or competence. Match the two parts of the sentence. Look at B and C opposite to help you. And if Y1 is a doctor responsible for their training program of a training, a demonstrator in anatomy teacher is who teach the section. A clinical trainer is a consultant who provides training during periods of direct clinical care. A supervisor is a consultant responsible for the training program of a trainee. A medical school is part of a university responsible for medical education. A placement is a period spent as a trainee in a hospital or in general practice. A college is a body of specialties responsible for delivering and assessing training in their specialty. A fellow is a specialist who has reached the highest level of their specialty. You read in full the qualifications of the doctors and surgeons. Look at C opposite to help you. Mr. H. Young husband, M. MB say HB, FRCS, RCSI, I. Bachelor of Surgery, Bachelor of Medicine, Fellow of the Royal College of Surgeons of England. Dr. C. Doyle, B. Med, Sci, DM, MRCP. Bachelor of Medical Sciences, Doctor of Medicine, and member of the Royal College of Obstetrics and Gynecology. Miss E. English, MBBS, FRCS, Bachelor of Medicine, Bachelor of Surgery, and Fellow of the Royal College of Surgeons of England. Dr. E. Meriwether, BM, MD, and FRCP, Doctor of Medicine, Bachelor of Medicine, and Fellow of the Royal College of Surgeons. The overseas doctor type of registration. To manage and treat patients in the UK, all doctor must register with the General Medical Council, GMC. There are several types of registration. Provisional registration is for doctors who have just qualified for medical school in the UK or from certain European Economic Area, EEA, member states. Full registration is for doctors who have completed their year's clinical training. Limited registration is for intentional medical graduates who have not completed the equivalent of a year clinical training in the UK. Specialist registration is for doctors who have completed specialist medical training and have a certificate of completion of training, CCT. The GP register is a register of all those eligible to work in general practice in the NHS. Note, for full details of the General Medical Council, see www.gmc/uk.org. PLAB. Before they can obtain full registration, some categories of overseas doctors are required to take the Professional Linguistics Assessment Board, PLAB. This PLAB is designed to ensure those who pass can practice safely at the level of an SHO in a first appointment in a UK hospital. Part 1 consists of a written test of knowledge, skills, and attitudes. Part 2 is an objective structured clinical examination, OSCE. It constant for 16 5 minutes clinical scenarios known as stations to assess professional skills. PLAB station advice of an advice OSCAS assess this skill. Clinical examination, your ability to carry out a physical examination of a simulated patient and actor training to play this role will be assessed uncomfortable or intimidate examinations will be carried out using a mannequin, an anatomical model. Practical skills, you will be asked on practical skills such as suturing and giving intravenous injections. Communication skills, your ability to interact with a simulated patient, or in some case, the examiner will be asked. Skills tested may include breaking bad news and giving advice of lifestyle. History taking, your ability to take and make a reasonable will be assessed. Advice of the station from a successful candidate. Read the instruction outside each station carefully. You have 1 minute for this. Don't forget the ABC, airways breathing circulation protocol, is very emergency station. Keep in mind safety precautions like throwing the sharps in the sharps bin. Check the patient, understand what is happening, then ask them about any concern they may have. Don't just give a lecture. Listen careful to what the doctor says. Now, charge are needles and blades, which must be disposed of safely in a special container called a charge bin. Mhm. What kind of registration might these doctors think? Look at A opposite to help you. A newly qualified Spanish doctor, provisional registration. A newly qualified Nigerian doctor, limited registration. A doctor who has successfully completed the first foundation year, FE1, Y1, full registration. A SHO who has successfully completed the foundation program and gained a certificate of completion of training after several specialist register post, specialist registration. You read the abbreviation in words, look at A, B, and C opposite to help you. Any doctor who wants to work in the UK must register with the GMC, General Medical Council. Some overseas doctors must pass the PLAB test before they can register, Professional Linguistic Assessment Punch. Part 2 of the test consists of a OSCE, Objective Structured Clinical Examination. In any emergency, remember the ABC protocol, airway, breathing, circulation. Before you can obtain special registration, you must have a CCT, Certificate of Completion of Training. Complete the test, look A, B, and C opposite to help you. My name is Musa, and I come from Yemen. I came to the UK about 2 years ago after graduating. Because Yemen is outside the EEA, I could obtain limited registration with the GMC. At first, it was very difficult for me to obtain a place on a foundation program. Although I speak good English, I have to take the OSCE test to show that I could work safely in the UK. If I had to give some advice to other candidates, I will be that at consulting stations, you shouldn't you shouldn't simply memorize set phrases. It's better to really think about what you are saying to actor and get information right. After completing my year clinical training, I was able to obtain full registration, but I found it difficult to get an SHO post in my choosing specialty pediatrics as hospital now have to demonstrate there isn't a suitable candidate from the EEA. Once I will complete my second foundation year, I should obtain a CCT, which will allow me to proceed to completion of training with the GMC, an important step on the road to become a pediatric